Hello everybody and welcome to our Chrysalis Wellbeing series number 2. My name is Jenny Pearson. I'm the Education Officer for the Primary Health Network and I sit in the New England. Tonight we have Dr. Amita Patel is going to facilitate. She is a GP from the Central Coast. Just before we go any further, I'd like to acknowledge the traditional custodians of the land that we meet upon tonight and pay respect to elders past, present and emerging. We're using Slido tonight and I see quite a few of you have already gone in there to answer our first poll question. So you just need to go to slido.com and the code is CWS2. And we will have 3 poll questions at the end of the presentations tonight and then our evaluation, which will only take a few minutes. So we would appreciate if you could just hold on for a few minutes before you leave. Our first poll question tonight was, do you have self-care plan and strategies that you currently use? 60% have said yes and 40% have said no. I'll just launch the next question and give you all a few seconds to answer. So the question was, do you feel confident to detect and identify triggers for someone you work with who may be in distress? 20% have said yes and 80% have said no. So I think we will all get a lot of information and knowledge from tonight's presentation. I will just hand over to Dr. Amita Patel and I will chat to you all at the end of the session.
Okay, thank you, Jenny. Welcome tonight, everybody. It's fantastic to have you all here and to have a great panel of presenters. We have psychiatrists, psychologists, and highly skilled people who are working in this field. And I guess the poll questions really show that we are focusing on, self-care, trauma triggers and upskilling ourselves. And at this time, given bushfires, given the floods, given COVID, there certainly seems to me to be a lot of disasters around and cumulative disasters now, which have their own impacts. So this is the second session of the Chrysalis Wellbeing series, and this session really is designed to assist in the recognition of common reactions to disaster, to trauma, and to prolonged stress. And I think we might be recognizing this not only in ourselves, but in our family, colleagues, patients, and our communities. The session aims to increase confidence in holding conversations about mental health using basic counselling and communication skills, and hopefully increase knowledge of practical strategies and help us find those responses and the resources to help people impacted by disasters and knowing when to refer and to get professional mental health. It'd be really good if everybody could use Slido and ask questions. We will have a question session at the end, so I'll be keeping note of the questions as they come through. And then we'll have the panel of presenters happy to answer questions for us. So without further ado, apart from acknowledging, that at this time, I'm a GP on the Central Coast. I haven't been affected by the floods, but I'm well aware that New England, Hunter Valley, entire communities are affected. Our colleagues, GPs, health systems are under strain. And I guess anything we can do to help, and this is only a little bit of it, is a good thing. So to start the ball rolling tonight, given this is organised by the PHN and they've got some fabulous resources out there for us, I'd like to introduce Scott Wood and Shane Moody, who are the Bushfire Recovery Coordinators from the Hunter New England Central Coast PHN. who will discuss their roles and support offered in bushfire affected communities. And I gather that that's now, obviously, it will be expanded to flood affected communities. And as you're aware, if you've looked at the Hunter New England CCPHN website, there are pages already on there. There's information for resources, for simple facts, like the fact that telehealth consults are now available to patients seeing a doctor for the first time, which is not the case elsewhere. So there are things like that that we can find from the website, which make it very useful. Okay, so I will hand over to Scott and Shane. Thank you.
Great, thanks for that, Amita. Yeah, you just did half my presentation. No, you didn't, but you just provided very useful information there. So I've got the slide which is about to pop up, and I'll start my presentation. We've got some amazing speakers here tonight, so Scott and myself will just be quite brief and just in explaining our role in the PHN and how the PHN has been involved in disaster, which is this is the first time we've been this heavily involved in disaster response. So I have written that it's bushfire recovery, but as you're all aware, the floods have heavily impacted us. So it's very likely this similar model for bushfire recovery will be rolled out for the floods as well. I am already starting to see a very similar response now. So the slide that's currently up is just a screen grab from the Department of Health's website, and it essentially shows the federal government's mental health response to the Black Summer bushfires. And you can see the 3 arrows up there, and there are 4 dot points. So the 3 arrows represent PHN's involvement in the mental health bushfire response. So we've been heavily involved in that package. If we can just go on to the next slide. So in this slide here, I've just put dot points of what we have done in our response. So the very first thing we did was worked on our health pathways and created a page that's relevant in regards to mental health and resilience, and helping GPs and other primary care clinicians refer on their patients onto useful services. We also changed our existing commissioning services to allow those who are impacted by the bushfires to go directly to the services that we commission. So it's Healthwise, Hunter Primary Care and Central Coast Primary Care, rather than going through their GP to get a mental health treatment plan. And once the person commenced their mental health treatment plan, then the GP was looped in that process. So it just helped speed up getting mental health treatment. And then we also brought in and commissioned new mental health services, including Catholic Care and Lifeline, to support those areas in high need that were impacted by the bushfires. And that's likely to happen again with our flood affected areas as well. So Scott and I were also employed as part of the response, and our role, which is quite unique to the PHN in the fact that we've gone directly to community and helped communicate mental health services that are available directly to them, and we work with mental health services to create clear and efficient communication for bushfire affected communities. And in the next slide, I'll go into that in a little bit more detail. The next point is that we had a rapid support grants. So we do currently have rapid support grants out for the floods now as well. And they are just very quick, up to $5,000 relief to try and improve social cohesion and community wellbeing, to reduce the impact of trauma from disaster affected communities. And we also received at the end of last year funding for evidence-based non-clinical mental health services, which Scott will go into further detail for both the grants and our non-clinical mental health services as well. If we could just go to the next slide. So in this slide here, it identifies the brochure that we've created to clearly help and direct community members as well as service providers for bushfire-related services that are available. So we created a table which is a simple self-assessment tool to use, and if a person identifies with a specific table, then they'll understand the services that are appropriate to them, which are listed below. So that's me for now, and I'll pass it over to Scott.
So, as following on from what Shane is talking about, we have funded 42 wellbeing grants across our Hunter New England Central Coast PHN region. They're valued, they have value between $1,500 to $10,000 for a really broad range of activities. They've been well received in the community, and I've been to quite a lot of the events. And what they allow for is the community resilience building, and also an opportunity to link people with appropriate mental health services if required. Some of our stakeholders and people that we work with, such as Bushfire clinicians and lifeline workers, etc., can attend these events also. So we're funded, as some example, there's been some really unique and interesting events, and I've been to them, and they're great. We're funded, as an example, I won't bring up all 42, but just to give you a bit of an idea, we did some mental health first training with New South Wales SES. We did a comedy night in Tibor and Torrington. The community of Boban, was quite a nice event. They've got and they were heavily impacted by the fires, doing a community mural on a shipping container in a community garden, which is in the school, which is going really well. Penderfield had a camp draft, and I've been to a couple of the Mid-Coast pizza nights that the Mid-Coast Council have organised. Pizza van that goes around. It gets really big turnout, and it's the community get together, and it's been really good. We've also had a community cricket day, and Kruger Aboriginal Land Council will be doing some traditional dancing, culture and arts. Next slide, please, Chris. Okay, so is the next slide up? Thank you. So, in addition to the grants, the federal government gave us a further $1 million funding to provide evidence-based non-clinical mental health services. So, what we've done is we conducted quite a comprehensive needs assessment with all the providers within the regions that we work. So we had input from people like the SES, councils, mental health workers across the regions, schools, land councils, DPI, etc. So from our comprehensive needs assessment, that we did identify 4 priority groups requiring additional services within the region, particularly to do with education and wellbeing. So the 4 groups that were identified that we are providing additional services to are young children and youth, 4 to 25, farm residents, Aboriginal and Torres Strait Islanders, and older populations. Next slide, please, Chris. So the PHN is going to fund 5 organisations up to $250,000 rather, each to provide mental health supports. These services and activities will be delivered we're just signing off on the contracts now, so starting probably April, May to the end of June 2022. And the successful organisations will provide the following activities: youth mental health first aid and a resilience project for children. There'll be bushfire healing, recovery and resilience workshops for farm residents, elderly, Aboriginal and Torres Strait Islander people. Some community building workshops. This one runs across all regions within the PHN using a trainer model with some online resources and a social media platform. And then we've got the Journey of Hope program for youth, farm residents and Aboriginal and Torres Strait Islanders. So we've got quite a broad range of activities and extra evidence-based non-clinical mental health services that we're going to provide. That's it from me. So.
Great. Thanks, Scott and Shane. That's a really very interesting presentation and some fantastic work going on at the PHN. I guess a couple of things really stood out for me. One is that needs assessment. You know, you've developed a project for particularly highly vulnerable groups, and that includes, you know, farm people and youth, the Aboriginal Torres Strait Islander population, and the elderly. And so designing community wellbeing events and skill building. And the other thing was really it's building skills in those communication skills like the mental health first aid, teaching that, training more people to have those conversations. So fantastic, and hopefully lots of people to take up the relief grants and to see that money going out actually would be great. So thank you. Don't forget to ask questions, and we will ask them of Scott and Shane towards the end. So moving on to the next presenter, we have Kath Walker from Krana Plus. So Kath is a psychologist and previously was a registered general nurse. She has over 30 years experience working in mental health in regional and remote Australia. Since 2015, she has worked with RFDS Queensland and with RFDS Victoria, so since the Gippsland fires. Kath is currently working on a Krana Plus project providing mental health training for health professionals in drought and bush affected areas. So welcome to Kath.
Hello, thank you, Amita. I think that 30 years history is not quite correct. I think it's a little bit longer now. I must remember to change that. I'm just waiting for the PowerPoint slides to come up. But thank you very much for that. And we'll just skip straight ahead because I think it's quite a packed program. What was interesting for me, just before I do get into the presentation, was the feeling of being out of control in these sorts of situations, because I don't have control of the PowerPoint and I'm waiting, listening to other people's talks, thinking, I'm getting nervous. I've delivered, I don't know how many thousands of presentations, but I still like to have an audience. And as I'm sitting there feeling my pulse rate going up, my heart rate going up, I think, where's my own self-care these days? And I hope I can join the 60% of you that I'm very pleased for, that have actually said you're on a track of self-care, and get out of the 40% that perhaps aren't doing it as well. So that's my particular aim and challenge for this little session. Next slide, please. And the next one again. And this is what Amita's already gone through with us, but we're really looking at, for ourselves and others, our colleagues, family, are we really recognising the effects and putting it down to stress, or making excuses, or seeing them as something else? Look at the real practical strategies. Evidence-based is our driving model these days, but sometimes absolute practical common sense works really well too, and we shouldn't forget that. I'd love it if you felt confident talking to someone you were concerned about, because often we hold back, and to the detriment of other people who may not get the help they need. Problem solving and planning our own well-being is paramount, I believe, into making it work, myself included. So next slide, please. Just a refresher, this one is. It should probably be a refresher for most of us, but I think we've got to remember this fight, flight, freeze response in pretty well much of our working life. We might not always be in that full. I'm keeping this language fairly simple too, because the neurobiology of the fight, flight, freeze response, as many of us will know, is complex, but just cutting to the core things. We look at the alarm stage, the fight stage, and then we look at, we can react in different ways. Next slide shows this graph a little better. So I think we've missed that's fine, we'll go with this slide. In the fight flight, we typically have a physical reaction, so our heart rate goes up, our breathing rate, the muscle tension. It's all designed by evolution to keep us safe, to get us out of harm. Emotionally, we can react in different ways, and mentally, we can have many questions and experience things such as shattered beliefs. Because of this experience that we're having physiologically, we often want to avoid the situation, or we try and physically avoid it, or we might try and avoid it with drug and alcohol use to decrease our anxiety and feeling of stress. Sleep is a really a very common reaction, ending up with poor sleep or disturbed sleep is a very common reaction to trauma. And impairment, I think I'm experiencing some of it now, and my words aren't coming out properly. You can have trouble with problem solving or with memory or with concentration and attention. Next slide, please. Okay, so what I was really talking about, and this is fairly critical if we're trying to help ourselves and others, as in simple terms, we talk about the alarm or the shock stage as stage one, and people call it the adrenaline phase, when all those sorts of reactions are occurring quite normally and to keep us safe and out of harm's way. The second stage people often refer to as the more cortisol stage. So when the first impact is reduced, it may be that the threat hasn't completely gone away, but this is still using enormous amounts of resources. So to try and adapt to the situation, the stressful event or the threatening event, the body and brain are working very, very hard, and we're not getting any time to rest or recover, which puts us at risk of this stage through exhaustion phase. And I'm finding this now with a lot of the people I'm working with across the alpine areas and all sorts of areas in New South Wales, up in Queensland, that they've been under prolonged stress for a long, long time and they're not recovering, and they're starting to talk about things like burnout, which is what we'll get onto a bit later. What we want to do in many areas of health and medicine is prevent things, and this is why we want people, and Krana Plus's job is very much around trying to get people to detect illnesses early, and particularly any of these mental health or stress-related illnesses, so that we don't get compounded with physical illnesses and symptoms as well. So next slide, please, Scott. The reaction to trauma and disaster, and this can be very similar to chronic sort of stresses such as with COVID, or as I've worked with many years in Queensland, people that are drought affected, drug affected they may be as well, but in terms of the physical, the difficulties they're experiencing, they go across that broad range that we looked at earlier with those slides. When you get physical effects happening, often there's a psychological. When I'm going to get better, how am I going to recover? It affects our community and consequently affects our relationships and our lifestyle. So some people, shock and disbelief might be overwhelming, but most experience temporary distress, but they bounce back. And most recover with other people's support, so friends, family. This is why we talk about social connections. It's a critical requirement for recovery for many people, although some do very well recover on their own, but it is better with support. Next slide, thank you. We see these different responses. So it could be a case that you're one of the people that's quite resistant. So that line second from the top, you've experienced a lot of traumatic events over your life perhaps, and you've managed to cope very well and it has very little effect. You may be in the sort of resilient group where you have the impact of the trauma and those physical symptoms we saw, and then you drop down in your functioning and how you're feeling, but then bounce back within some weeks or months. You could be in the delayed group, and this is where many of us have worked with people that have experienced trauma through combat, and they might have been relatively okay as they described themselves to me. Sometimes they didn't really feel any mental health problems. They might ignore the fact that they perhaps drank more than was helpful, but they for years and years and years went along, and then all of a sudden they're in a full-blown post-traumatic stress reaction. or you can get the people that seem to drop straight away in their functioning and feel this sort of chronic set of symptoms. Next slide, please, Scott. What we want to get across to people that are experiencing these types of stress reaction is a lot of the education around what it is, because I don't know how many people have said to me over the years, so you're telling me I'm not crazy? And they'll say things like, oh, it's just my fight flight. Oh, that's all right. And then we go through, well, it's not really okay in terms of you're not feeling very well and your sleep's horrible, but it is normal and we need to work with it, and we need to work with what the body and brain are trying to do for you and help correct it. It's not a specific thing, stress, as my partner's son says to me when he goes off rock climbing. For me, watching it looks terrible, but for him, it's a challenge. So you can see how we can start to use people's thinking in a way to actually help them help themselves, because they may be able to adjust some of the thoughts they're having, which may have become quite catastrophic since going through a lot of traumas. They just feel there's no hope anymore. So when you feel that the demands are just exceeding all your coping skills, that's when you tend to say that you're under stress. That's if you admit to it. Next slide, thanks. Okay, in many occasions when I've been in disaster areas, the first people there are the emergency workers, and the Red Cross are very close behind, and they're there with their psychological first aid. Why I brought it up here is because it's just to remind us again, whether it's for ourselves or helping colleagues or friends, family, patients, think about the safety very broadly. When I said earlier that disaster has a community reaction, it has sort of a community sense of contagion too. If everybody's feeling terrified, they can all move as a bit of a group. And sometimes they just need things like, it's okay, I'm here to help, and my name's Kath, and let's see what it is that we can best do. So even in the tone of your voice and your body language, you may be helping to calm someone. And in the calming, you're bringing them back a notch from up on the high level of the curve into a place when they can actually think and concentrate a bit better. And that's when you can actually come in then with just some of the self-efficacy and some of those statements that I don't mean to be trite about things, but it could simply be that you've done an extremely amazing job in the way that you've dealt with this last week. It may be that that's the sort of thing they need to hear, and words around that, try and hold on to the sort of people you trust most and spend time with them as much as you can. And a sense of hope is one of the most critical things. Next slide, thanks. Got a bit of an eye on the time here, so I'm trying to move it along. But just for that moment, recognise that you're doing something for yourself here tonight. You're starting to consider perhaps, are there ways you could improve some of your own management and drop that stress level down just a notch, even by the end of this talk. That'd be terrific. Next slide. We as carers are at risk because, as we said earlier, that we're not getting the chance to rest and recover. We can work some enormously long shifts, and even when we're not working, we're thinking about it, what we did right, what we did wrong quite often, and we're just not getting any pleasure. And sometimes we can start to feel a sense of hopelessness because the work seems so overwhelming. When you're living in the areas I do, in a rural community, you're invested in the community, and we do a lot of what we call supermarket, trying to stop the consultation and just be able to do our hello and keep hold of our boundaries. This caring connection we establish can make us very vulnerable to our own distress. Next, thanks, Scott. Ongoing stress we've covered sort of briefly, but we talk about once you're past all those very first stages of real alarm, you can get a general unwellness, this lack of energy, the headaches, the muscle pain, gut problems, blood pressures going up. Psychologically, it can be everything, really, the irritability, the anger. People often describe other people under stress as they're just not themselves. They used to have such good humour, but that's gone. Cognitively, they can be thinking very intensely all the time about the threat and how do they get out of it, how do they solve their problems, remembering things going round and round and round. And often there's difficulty making decisions in this sort of state that really are clear. You might think they are, but they might not be the best. Your problem solving, creativity, a lot of those things just out the window for a bit. Next one, thanks. So we often hear now people being described as experiencing secondary trauma. That can happen quite suddenly. It can happen in response to somebody who's come in and told you a story that has just brought on all the similar symptoms of post-traumatic stress. So they're having these memories going round and round of that event. They're having the physiological sorts of problems. It could last for some days or it could last long term. Vicarious trauma, they tend to talk about in terms of a cumulative response. We don't want these conditions as health workers, and we certainly don't want friends and colleagues, family to have them either. We'll just define them a little better in the next couple of slides. Next slide, please, Scott. It's hard to tell what the delay is, so I'm sorry if I feel like I'm harassing you there. I don't want you being under stress. Compassion fatigue and the cost of caring. Loss of pleasure in life can come up and creep up on you. You just work, and you don't feel like you've got the right to take time off. You can start to feel hopeless in the face of the enormity and the number of stresses people are experiencing, and just how little you feel like you have got to give as a health professional. It could be in a stage where you might be feeling you're just blaming others. You think, they should be able to sort themselves out. This might be uncharacteristic for you. You could start isolating yourself because you feel like you just can't take anymore. Again, the trouble concentrating and feeling the burden of people suffering. Next slide's talking about compassion fatigue some more, and we're talking about how the experience of nightmares can be the very reason that you're experiencing very poor sleep. Once your sleep's poor, you can get into a lot of other physical difficulty as well. The fatigue people describe can just be just ongoing exhaustion. They might be in denial that these symptoms aren't really happening at all, or you just won't acknowledge them because you should be better than that. It's often your self-talk. You might bottle up emotions, you might overeat, you might just be generally poor in self-care. You just haven't got time to be doing the daily walk. You might be using a few more glasses of wine or other types of drugs to try and calm some of the reactions you're experiencing. Next one, thanks. What are we going to do about it? First, we've got to recognise that when yourself or your colleague or your friend or a patient, they're not starting to improve. So some weeks or months after a trauma, for example, you're starting to really look very closely at the signs and symptoms you or they are experiencing. Those persistent reactions that just interfere with your daily life, that's a giveaway that you're just not functioning the way you think you should be. You might be isolating yourself, and you might be feeling this sense of hopelessness and loss of pleasure we've been alerting you to. Next, thanks, Scott. You often see people that are taking more risks. They just might be driving that bit faster. They might be thinking thoughts of self-harm. They might be having suicidal thoughts. They might be having the real post-traumatic type symptoms of being very on edge. You're anticipating danger. You're irritable, sleep's poor, having nightmares, flashbacks, not wanting to go near the place that that the event happened or the series of events happened. Next one, thanks, Scott. Distress doesn't always look typical. It doesn't always look like a diagnosis of PTSD. It can be someone who's just very angry. It can be someone whose behaviour you're finding as a treating clinician very difficult to manage. It's not them, but they're really hard to work with. They might be just exhausted. They might be making mistakes. They might be the best timekeeper in the world, and they're not getting to work on time. They might just have that absolute flatness and lack of motivation. Be aware that it can take many forms. Next one, thanks. The practical help and reassurance, this is what I was thinking My mother, the nurse from World War II, the practical assistance, the safety, the looking after them, the getting them a good feed, the cup of tea, the social support, the general encouragement, the listening, talking, and I highlight the listening. That can be some of the most important thing we can ever do for someone. What we now come to know as the pillars of good health, the exercise, the relaxation, the nutrition and the sleep. They're all a long talk on their own, but all critically important. Often I work in communities, I'm very often in remote communities. Often when they don't know me, they don't particularly want to go and see a mental health clinician, but they don't mind coming to a sleep workshop. It's one of my first ways in and has been for decades. I talk to them about sleep. Sometimes we never actually get onto the depression that seems evident, but the sleep seems to do the trick. That's not to say we don't do good diagnosis, and I don't want to give the impression we're not very respectful of evidence-based. These are tips. Enjoyable activity is something that it was very evident to me in the 2009 fires that after nearly a year of cleaning up and chainsawing, and people weren't getting out to play with the kids. They weren't having that game of cricket. They weren't in their normal routine. They weren't making major decisions, and that was really problematic. The avoiding alcohol and other drugs can be very difficult in communities because that's how everyone gets together. They come for the barbecue. But keep an eye out for people that are really having difficulty in this area. Next one, thanks. Have a conversation if you're concerned. This has been around since I worked with Beyond Blue 20 years ago, I think. Have the conversation if you're concerned. What would you do? And this is what we say at Bush all the time to the stock workers, the head stockmen and the ringers is, oh, I don't want to talk to them about mental health. I'm never going to go down there. It's too embarrassing, or whatever they say. Well, what would you do? And you stop at car accidents all the time. What would you do if someone's clutching their chest and appears to be in pain? You're great at your remote area first aid. This is what we're talking about. Have a conversation. You don't have to be a trained counsellor. Think about it a good time. Think about a good place and listen. Ask the questions. How have you been going? You don't seem yourself lately. Don't worry about fear of offence because you think, oh, I'm not trained in this. I don't know what to say. I've put my foot in it many times and it's not intentional, but it's a desire to help and you haven't said things the right way. It's very easy to apologise. It's not ideal to put your foot in it, but it's far better to ask and then say, I'm sorry, I seem to have offended you then. It's not what I meant. I was just a bit concerned because you didn't seem yourself. Keep it simple and don't keep pressing. It might not be the right time and place. We don't need to hound people. So that's why the advice is generally around, don't just keep going with the question and answer. Next slide, thanks. If the conversation's difficult, just keep remembering that you as a health worker, of course, may fit into a different category, but general advice, this might be for you as a friend of someone and you may not be wanting to be in your role as nurse or GP. You can still just focus on their health concerns and you can still just listen and keep talking to them and give the message that help's available. You don't see myself lately. How can I help? Can I refer you to someone else that might be able to help? Next one, thanks, Scott. When to encourage professional help? It's when they're not improving. They're unable to get on with their life. It's really interfering with their life. It's impacting on others. It might have an ongoing effect on their mood, and they may be having suicidal thoughts. That's the time we really need to act. We'll go on to the next slide. Just back one, and that's really about asking directly. If there's any concerns at all, you say, have you been thinking about how you might take your own life? Have you been feeling so depressed at present and so stressed? You have thoughts like you don't want to live anymore. They're very direct questions we suggest people ask. and then don't leave them alone, and we link them into the services, their GP and health crisis. Obviously, due to this very short summary tonight, that's not a very extensive coverage of what we do with people having suicidal thoughts. If you're unconfident in this way, please get some further training, and we'll be hearing from Phoenix later, so that's terrific. I'm not going into the area of mental health training in this little talk. Okay, a couple more slides to go from me. So next one, please. It's all about balance. Next slide. There's a lot of balls get thrown at us on a daily basis, and we've got to top up on our coping sometimes. So it is a hard one. If you can, throw some balls out of all the basket of things that are being thrown, and look at what's controllable and what's not controllable, and try and go for the controllable ones. Your barriers to self-care, I just really encourage you to reflect on how you've been going with this. You had a poll question, think through it. Is it because you think, I just haven't got time, I've got to keep working. If I work harder, I'll be all right. Are you exhausted? I haven't got time. Everyone else is doing it worse. I shouldn't take time off. Or you might not be aware. You're just so busy, you're not really aware. And that's where you need the couple of minutes that I had before this presentation started. Think, oh, I can actually feel my heart racing. Maybe I better get a bit better at that slow breathing. Next one, thanks. When we are feeling those barriers, problem solving it. Look at what your triggers are. When do you feel the back of your neck tighten? When do you feel the symptoms that you don't want? You're getting more headaches. Look at what's within your control and see if you can problem solve what you can do about it. Next slide, thanks. We've had a brief look at these. I can just encourage you for the look at the resources we've got on our website. Phoenix has got resources because there's just so much written about relaxation, exercise, social connectedness, your nutrition and sleep. You can't ignore the evidence anymore. And relaxation could be going out to a film for sure, or it's certainly the evidence is very strong that a learned relaxation technique that really gets you into, as they call the alpha rhythm, it really has it's an antidote to a lot of the stress symptoms that you're experiencing. So get onto some of those, problem solve your self-care, get over the barriers or get away through them and see which of these tiles you can pick up on a bit. Next slide, thank you. You need to do it all day. I hate to say it, but what's the strategy for the start of the day? How are you feeling in the morning? How are you feeling during the day? If you feel that back of the neck tightness, use one of your strategies to get it down before it gets worse. Listen to yourself and reflect with your best friends and establish that work-life balance as a goal. Next one, thanks. Feeling like nearly there. Practice it and plan it and use places like Prana Plus. As you'll see at the last slide, we've got a 24-hour, 7-day-a-week telephone line run by psychologists, and you can actually have a number of sessions. You can be anonymous, and you can actually request to speak to the same person again. But get those breaks from work as well. Get some pleasure up. I would say just 1 minute a day, just get a couple of minutes a day, even if it's a nice memory. Get the balance of exercise, relaxation, meals, and hope. It's really a really important thing to notice if you feel like it's going. Your humour is important, and remembering those successes. Next one, thanks. And we've got through to the finishing line. I really hope some things stuck in. I really hope there was some value in that for you. And they're the sorts of numbers that you can ring. And there's one more slide to go, which is just showing you the Bush support line for Crana. All these resources will be available to you. Thank you so much for listening, and good luck with the plan to the 40% and the 60%. Thank you.
Thank you for that presentation, Kath. Fabulous stuff, and I hope everybody else like me actually during that session could feel myself reflecting and thinking about my own self-care strategies, and already thinking about, well, yeah, that's where I'm at, or that's what I need to do. And I think we all appreciate the role of family, friends, and social supports as key to this. I'd just like to add one more resource on there, and it's not a conflict of interest, but I am on the board of the Doctors Health Advisory Service New South Wales, which provides, like Crana Plus, a service for doctors, dentists, and vets and their families, which is anonymous, 24-hour phone service for anyone who wants to use it. And you get answered by a doctor, a GP usually, who then, essentially can talk you through whatever and get resources. So plenty of resources out there for us and our patients and communities. So thank you. And any questions for Kath, don't forget to type them into Slido and we'll come back to that. So as Kath mentioned, we're going to hear now from Anita Savic from Phoenix, Australia. So Anita is a clinical and counselling psychologist with extensive experience in the mental health and wellbeing of high-risk populations. She's had 10 years experience working within the police and emergency sectors service, for example. Her clinical experience includes delivering evidence-based mental health interventions to those impacted by trauma. At Phoenix Health, Anita works across service development and training projects that focus on translating evidence into practice and improving capacity to manage the impact of traumatic events. So really look forward to hearing from Anita more about the work she does. Thanks, Anita.
Fantastic. Thank you, Amita, for the lovely introduction, and it's really great to be joining you this evening. Excellent. Thanks for that. Next slide, please. Just a bit of background about Phoenix, Australia, for those of you who may not be familiar with the work that we do. We're Australia's National Centre of Excellence in Post-Traumatic Mental Health. So really the core of the work that we do does centre around trauma and recovery from trauma. We are a not-for-profit organisation. We're affiliated with the Department of Psychiatry at the University of Melbourne, but we do have offices across the country, including Sydney, Brisbane, Adelaide and Canberra. We do have a strong research arm, so we build evidence and then translate that knowledge and research into action, which is the part of Phoenix, Australia that I work in, where we develop resources to support clinicians and mental health professionals to provide improved treatment options and greater support for trauma-affected individuals, families and communities. Next slide, please. So just a little bit of context before I launch into sharing with you or talking to you this evening about a couple of key initiatives that we're currently delivering at Phoenix, Australia. As Kath mentioned, trauma is common. We know that about 75% of people that you might be working with would have experienced a traumatic event. But as Kath also mentioned, fortunately, most of those people will actually recover from trauma with the appropriate support, including support from their loved ones, family support, as well as support from workplace and colleagues. What that graph highlights to us is what we refer to as a stepped care approach to disaster, following disaster. And it's consistent with the current best practice to supporting mental health recovery and care for psychological problems for those that have been exposed to a potentially traumatic event, such as a disaster event. And what this does is it provides a framework to guide the provision of appropriate interventions and treatments for patients with mental health problems following trauma and following exposure to disaster events. So a stepped care model of mental health treatment involves initial provision of an intervention to patients that is the least intensive, but also likely to be the most effective. So after a period of monitoring, The least intensive intervention is either stepped up or stepped down in intensity, depending on the benefit that the person has derived from the intervention that's been initially offered. So GPs have a critical and important role to play at each level of this stepped care approach. GPs and other primary care providers can initially provide lower intensity interventions. So we've got down the bottom of the graph there, psychological first aid, as an example of some of those lower intensity interventions. And then if necessary, provide some of those higher intensity interventions or refer patients to mental health specialists if those higher intensity interventions are required. So as you'll see, as we go up the graph and up the intensity, we are seeing patients who are experiencing greater impact following exposure to a disaster event or other potentially traumatic events. Next slide, please. So I'll share with you some information about 2 key interventions that Phoenix Australia is currently delivering to support you in your disaster-related work. Next slide, please. The first project that I'll talk to you about is our Bushfire recovery project. So as part of the Australian government's mental health supports for bushfire affected Australians package, it's always such a mouthful, that one. Phoenix Australia is currently delivering training to frontline workers and to general practice staff, a range of training programs to support you to better support community members as well as your colleagues. So this project aims to work with both emergency services personnel, and as we've heard this evening, they're often the first people on site during a disaster event. So it support our emergency services workers as well as general practice staff to enhance your ability to support community members' recovery from bushfires. There's also modules in this training that will support you to promote your own resilience and psychological recovery from bushfires. And that's really to recognise and acknowledge that working with traumatised populations can be quite taxing on us as workers as well. And as I mentioned, to support the resilience and wellbeing of teams and across organisations. Next slide, please. So in terms of what's available and our key deliverables, we are rolling out a trauma-informed care training program for frontline emergency service workers. As part of this package, we're also rolling out psychological first aid training or PFA training. This particular program is designed or targeted to managers and supervisors of frontline emergency services personnel. And then the key training package that's most relevant for you is the trauma-related resources and training that we've developed and that we are rolling out to support general practitioners and other healthcare professionals and their healthcare teams. Next slide, please. So I will provide you with some information about the frontline emergency service training that we have available for context and for background. We're really mindful that often in a disaster scenario, people are working very closely together. So it's good for everyone to be aware of the training that's available. So the trauma-informed care program that we have developed for frontline workers is designed to build a trauma-impacted individual sense of safety, the sense of control and empowerment through a strengths-based approach. So the focus on safety, control and empowerment is really to support people's recovery. We know that following exposure to disasters and other potentially traumatic events, these are the areas of an individual's or a community's life that tend to be impacted. So we see changes in their sense of safety, control and power. And so really our trauma-informed care course is designed to help rebuild those elements of an individual's or a community's life. So the course teaches the principles of trauma-informed care and the related skills. So this includes information on the impact of psychological trauma. So much like the information that Kath has just provided to us, We also talk about the principles of trauma-informed care and how people might be able to apply these principles to their respective roles. And how to assess and talk about trauma safely and sensitively. Often people will ask us, you know, how much do I support someone to open up about their trauma? Do we keep it contained? How do we manage some of those situations? And so the course will cover those elements. We also then provide a skills-based component or training in brief recovery-focused interventions. And as I mentioned, there is a module there on looking after yourself. So this particular training is online mostly, and it's a one-day online training course. Next slide, please. So the next training course we have available is the Psychological First Aid, or PFA, and this one is targeted towards managers and supervisors of frontline emergency personnel. Again, another one to keep in mind. I'm mindful that many of you might even have frontline workers as your patients, so this is a really good course for them to do. So Psychological First Aid is the current best practice and recommended approach for us to use following exposure to a disaster or other potentially traumatic events. It's practical, it's flexible, and as I mentioned, it's designed, it's an approach for us to support people who have been affected by trauma. One of the aims of PFA is to help reduce that initial distress and also assist people impacted by potentially traumatic events to cope better with some of those distressing symptoms that they might be experiencing. So the course teaches people about the trauma responses. With most of our trauma training, trauma awareness is a core aim. So we tend to have an education component around how people respond to trauma, what some of the signs and symptoms are, so that we know what to look out for, but also so that we understand better why people might be behaving in a certain way. We also then take people through how to provide PFA safely and effectively. And Kath mentioned earlier the importance of listening and communication skills. Sometimes these things can seem so basic and core, but it's really important to revisit these. We know that in a disaster setting, when people are hyper aroused or experiencing trauma symptoms, listening and communicating can be impacted. So it's really these skills are really at the core of PFA. We also cover skills for helping to calm and support people who might be experiencing some trauma symptoms. And again, we end this session as well on looking after yourself. So we try and incorporate self-care into the bulk of the training that we do. Next slide, please. And this is the training that we've developed for our general practice community, and it's titled Supporting Individuals After Disaster. So whereas the previous two trainings are about 7 hours in duration, what we've done for you is develop a much shorter introductory training course, and it's based on the trauma-informed care principles. So it's tailored specifically to the needs of staff working in general practice and other community healthcare settings, including practice managers, GPs, and other healthcare workers. And the training it's 90 minutes, and it's an online training. It has those core modules that go for about 90 minutes, with the option to complete other topics that might be of interest. So we have launched a couple of those optional topics already. They include self-care, really critical component of delivering trauma informed practice, as well as a module that looks at the recently launched Australian guidelines for the treatment of post-traumatic stress disorder. So that might be another module that might be of interest to many of you. It's worth noting that trauma-informed care and that approach, a TIC approach to working, is not about changing your current role at your practice or at your organisation, but it's about adapting the way that we approach our work so that we can incorporate those trauma-informed principles. So in this training, and again, it's a brief 90-minute module, we cover topics including understanding the principles of trauma-informed care, which includes things like safety, power and control, instilling hope and recovery, and then how they relate to your practice and how these principles might be able to be implemented into your day-to-day work with traumatised individuals. We cover the impacts of trauma and then how to safely talk about and manage trauma disclosure. I'm sure you've experienced in your clinical work with some patients, you know, they can sometimes have a tendency to over disclose. Others, it's like pulling teeth. They're really hesitant to talk about their trauma experiences. So we cover this as a topic in this particular training. And look at situations where it's how we might be able to safely talk to people about their trauma. And then we cover off the skills-based component by offering some simple strategies to teach trauma-impacted individuals to help them deal with their distress. So some basic sort of strategies that you can use with your patients and others or colleagues at times if needed to support them if they are experiencing trauma symptoms. Next slide, please. So in terms of who we're encouraging to do the course, as I mentioned, we have designed it as a brief course specifically to manage, specifically for you, because we understand that we're all quite time poor nowadays. So it is designed as a brief introductory course for a range of professionals who work in general practice and community health settings. As I mentioned, that includes GPs, nurses, allied health providers. You might want to include your medical reception staff or practice managers as well. TIC really is an approach that it's about a way of running your whole service delivery practice, really. It's an evidence-informed approach, and it can be used within GP practices and other settings where you're interacting with individuals and communities who've experienced a potentially traumatic event or a disaster event at some point in their life. And as I mentioned, TIC is about creating an environment and, you know, in many cases, it's a workplace environment and interacting with trauma-impacted individuals in such a way that allows for their recovery from trauma, as well as looking after your own well-being. Next slide, please. So if you are interested in registering for that particular training, I have a link up there on the screen, and we can certainly provide this for you after this evening. It is free training. It's available for those communities who have been impacted by the 2019-2020 bushfires across Australia. So that really is our only criteria for completing this training free of charge. Or you're more than welcome to contact me directly, and I can put you in touch with the team to register for this training. Next slide, please. So I'll take you through another one of our initiatives that we have just recently launched. Hopefully some of you might have attended our launch event not too long ago. And as we have been recently reminded, disasters, and particularly natural disasters, are commonplace in Australia. So this particular resource is really designed to support you in your work by providing current best practice resources to upskill mental health professionals and other health professionals. And we really do hope that the Disaster Mental Health Hub will be able to be a resource that you can use to support you in your work. As I mentioned, we recently launched it. It provides a broad range of resources and training programs specifically designed for health practitioners who support disaster-impacted individuals and communities. So we're targeting this to our frontline workers, emergency service workers, as well as community support and volunteer workers. and allied health practitioners as well as GPs. Next slide, please. What you'll find on the hub is a broad range of materials that are provided to you according to disaster phase. So we've divided it up into prepare, respond, and recover. So resources to help people prepare what you do and how you respond during an event, and then how you help people or support people to recover following a disaster or other potentially traumatic event. So as I mentioned, these resources are also of no cost, and they're available for a broad range of health professionals. There are links to free training courses. There are tip sheets and fact sheets, as well as information regarding other referral options. Next slide, please. So this is just a snapshot of what the Disaster Mental Health Hub looks like. So if you go onto the link that we've provided for you, you can navigate your way through those three areas that I've mentioned: prepare, respond, and recover. There's a broad range of topics and trainings on offer. We have a sleep kit, for example, as well as a physical activity kit that's been developed with experts in that area, as well as some general information about trauma that you can download and share with your patients. Next slide, please. So just another look at one of our training page on that website. And again, I encourage you to have a look. There's really brief, bite-sized sort of resources that you can access. Some of those resources only take 5 to 10 minutes, and that's just in acknowledgement of the fact that we recognise that you're busy. We are very time poor. And so, yeah, some short, sharp resources for you to access there. Next slide, please. We also have some general disaster and other trauma resources on our website, including COVID-19 resources for our flood-affected communities, as well as other disaster resources. So I'll leave that with you. Please go to our website and have a look. I think we're running out of time, so thanks for your time this evening and for your invitation, and I hope you're able to have a look at our resources, and hope to see you in one of our trainings.
Great. Thanks for that, Anita. Okay, I'm well aware we're a little bit over time, so I'm just going to push on and introduce next Dr. Mike Millard, who's from This Way Up. So Dr. Millard is a consultant psychiatrist based in Sydney and clinical director at the Clinical Research Institute for Anxiety and Depression at St Vincent's Hospital and the University of New South Wales. It's also the director of thiswayup.org.au, a leading provider of digital mental health and wellbeing services. So we're going to hear a bit more about This Way Up, I think. Dr. Millard, thank you.
Great. Thanks very much. I will try to push through the presentation quickly so we do have some time for questions at the end, because I think that will be helpful. But thank you for inviting me. I'm a psychiatrist at St Vincent's. I have actually, one of the reasons why I was, well, we'll skip to the next slide. And so just a bit of background of who we are. So we run the statewide anxiety disorders service, which is really our history. About 20 years ago, we took the treatment that we were providing in the anxiety disorders clinic, and along came the internet, and we thought, how can we make this more available for people? So we took what we did in our manualised treatment, and that's the evolution of our This Way Up service, which I'm sure that many of you might be familiar with. So we'll go to the next slide. So I'm not going to spend much time talking on the next slide, other than because we've had some fantastic presenters talk about the mental health impacts of disasters. But also recognising the impacts of disasters on the mental health system. And from my own my own learning and my own experience in this, I had the privilege of going down during the emergency bushfire response to the South Coast. And I think I was the only psychiatrist that was seconded down to provide immediate support. And I think there really are the three parts of prepare, response, and recover. And we're all in different stages of that. And I certainly learned a lot about that when I was having my own first-hand experience down there. And the other thing I'd probably say is that I've worked in lots of regions around Australia, Western Australia, Queensland, and I was a psychiatrist in Armidale. So the Hunter New England region is a region that I'm very close to. And I must say it is one of the regions where there is the best network of GPs. So thank you for letting us come along and to present to you tonight. And if I have one message that I'd say right now is my main aim is for you to get familiar with our website. And I'll show you a little bit about that as we go through. So we'll skip to the next slide. So this is our website, and we'll skip to the next slide. And really, what the hell is treating people over the internet? So we've specialised in treating people online since 2011, which was when This Way Up was essentially launched. And what the benefits of treating people over the internet are really around the fact that we break through a lot of the barriers that exist. So in terms of time, in terms of certainly the geography and certainly the stigma are the two that I'd probably like to point out. As I guess we all know that, and the literature tells us that medical practitioners can be particularly concerned with either the perceived stigma or the self-stigma around accessing support. And this can be particularly difficult within smaller communities in terms of access to psychological or evidence-based psychological treatment can be quite difficult. Certainly with the telehealth and the telehealth provider numbers now, it's quite a bit more easy to access help that might be outside of the community. But there is a real benefit in I think, and I'll talk about the way that our courses are structured and explain why that makes sense, why this might be something that we can throw into the toolkit of interventions that we have available. So if we go to the next slide. So we know that the gold standard treatment for the majority of high prevalence disorders is cognitive behavioural therapy, and that's really treatment that teaches us about the way that we think, we feel and behave, and the way that they're connected. It's usually delivered face to face. So there is the evidence is that the research has been done, and it is clear that if internet-based cognitive behavioural therapy is as effective as face-to-face CBT. So that's been done in randomised controlled trials and it's been shown in meta-analyses. And I have to mention as well that we've just had the clinical practice guidelines for depression that have been released by the College of Psychiatry. They've recommended digital interventions as a first-line treatment for mood disorders, for depression. And the year before we had the anxiety disorders clinical practice guidelines that said that digital intervention should be the first line across the anxiety disorders. So our research shows us that the biggest reason why people don't use or don't include online treatment as an option is because they're not familiar with it, because they weren't aware that either particular sites or particular services existed. The key things that I'd probably point out is that that online CBT essentially can be done at any time. So we have the majority of our users for our service access our service after hours. So they're sitting at home and they're able to, in the peace and quiet of outside of work, to be able to access a module and to be able to start working their way through their course. We know that when someone starts one of our courses, we know exactly what the skills are that are going to be taught. So we know CBT is all about teaching people skills, and we've heard about different variants of that tonight. We know that we teach people the skills. The skills of CBT are super simple. The hard part of cognitive behavioural therapy is putting the skills into practice. So and I'll talk about the way that I use some of this. I use the courses in my clinical practice here at the Anxiety Disorders Service. But the best way to become familiar with this is to be able to do one of the courses yourselves. So we'll go to the next slide. So as I've said, they teach core psychological skills. They're flexible, they're self-paced, you can access them at any time. They're confidential. That we collect very, very, very little information about our users. And certainly I know that in the work that I've done when we've worked with medical practitioners and health services, is that people are quite concerned about who will have access to the information, or will people necessarily be aware that I'm doing the course. And our courses are completely confidential. And this is one of the reasons why the Black Dog chose to partner with us as the online provider for the health worker intervention that they've been providing. Our courses don't need a referral. They can just be available as self-help, and I'll talk about that in a second. And of course, when they're compared with an equivalence dose of face-to-face treatment, they're extremely low cost. One of the things when certainly I worked in the Hunter New England region was that it was very difficult to get people in to see people. So these are a terrific way of bridging that time while we're waiting for someone who may need face-to-face services to be able to do something that's evidence-based and helpful while they're waiting to get in to see what might be the next step. We'll just go to the next slide. So I mentioned that they're all evidence-based, and I just want to reiterate that. We've done over 36 randomized control trials as a department here. All of the disorder courses that are on our website have been run through a randomized control trial. We have also done effectiveness papers as well. So when we say that we know something works and it's beneficial, it is. We've had 51,000 people working through our courses. There's more than actually 15,000 clinicians who use our courses in their practice. And that's maybe general practitioners, it's psychologists, it's clinical social workers, it's counsellors. So it's all about integrating our tools into clinical practice. And that's one of the things that we're very strong believers about at This Way Up, is around helping to equip you with the digital tools that might help you to be able to help your patients in a better way. It says there, and it comes back to the research trials, that 80% of people who finish one of our courses benefit significantly, and 50% of those are no longer troubled by the symptoms that they were troubled by when they started the courses. So the courses work. And that's, as I say, it's the equivalence data that comes back that says that that's the same numbers that we will be using for face-to-face CBT as well. We'll go to the next slide. Okay, so we've got just the overview. We've got different types of courses. We've got wellbeing courses that are shorter. We've got transdiagnostic courses, and then we've got the disorder-specific courses. The one I'll quickly point out to you, which is my favourite, is the mixed anxiety and depression course. And I would also throw in here this managing insomnia course, because we know that, and certainly when I worked in general practice, a sizable number of patients would be coming and complaining of as they're presenting symptom of insomnia. And as Kath talked about before, that's one of the things that her organisation does, is start with sleep. It's an excellent course. It's not sleep hygiene. It's a proper CBT-based sleep initiative. And as I say, we've trialled it and we know that it works. And you can see the list. So we'll go to the next slide. So this is what one of our courses might look like. So it follows the illustrated story of someone who is experiencing symptoms like like either yourself is experiencing or your patients are experiencing. The first module is always around psychoeducation. And you can see some of the slides there. So that gives you an idea of what it looks like. To the next slide. So we've talked a bit about this tonight, but this is really around the benefits to you as a practitioner. The fact is that this stuff works. As a clinician, it breaks my heart every time when I see the numbers coming back. We see it, it works. And what I would ask is for you to experiment with it much in the same way as if a new medication came out. It takes a couple of times for you to work out, how am I going to be using this in my practice? So that's the kind of the approach that I would be encouraging you to take, is that it takes a little bit of time to become familiar with these type of interventions. To the next slide. So I'll say on our website, there's 2 pathways. So it's free when it's clinician supervised. And that means that your account, if you register as a clinician, which is also free, so you then prescribe the course to your patient, and then you can follow their progress through the course. So you can see their outcome measures, and you can see them as they work through the different modules. All of our wellbeing courses are free. So the mindfulness course, the insomnia course is free, and there's a shorter stress course that's on there. There is a fee for the disorder-specific courses, and it's $59, and that is if the patient just goes, if someone just goes to our website, they can start doing one of our courses tonight, and it's kind of like if you're going to buy a medication off the shelf. Whereas if it's linked to a clinician, much the same as if you're PBS subsidised, the course is free. I do have to say that in talking to the team tonight is that we wanted to give you guys a code that waives the cost of the courses for your patients, because we're really just about increasing people's, I guess, experience. And also, as well, if you wanted to have a look at doing one of our courses, then we have a code that waives the fee, and I can pass that certainly on to the PHN to pass through, but I'll just read it so you can write it down if you're using the course, and it's TWUHNEMH. So it's This Way Up, Hunter New England Mental Health is what that stands for, but it'll waive the fee for all of the courses. Do you want to move to the next slide? We use the courses for mild, moderate and severe in each of the disorders, and everybody gets the benefit or a benefit in terms of depending on the disorder. It may not be the only treatment that people are having, but it may be part of the patient's treatment package. So if we move to the next slide. So this is a hard to read slide, but this is just the 4 different ways that we use the course. So we use our courses while people are waiting to get into people. So that's how we use it here at the clinic. So instead of waiting 6 to 8 weeks to get in to see the psychologist, they're actually working through something whilst they're waiting to get in. It may teach them enough, and they may get enough benefit to not need further ongoing treatment. I use it as kind of blended care. When I see someone, they see me 1 week, they do a module, and then the next time they come back to me, then we can talk about what they learned in the module. It actually speeds up treatment, and it's a very helpful way of doing a blended treatment, and a helpful way of helping people to learn exactly what the skills are, and then my time is used to help them apply them. And then, of course, it's a way of doing a relapse prevention after I've finished seeing someone, and if they want to learn more. Next slide, please. This is just a slide about the benefits of clinician supervision. It's really just around, it can be helpful. People are more likely to complete the course if they know that you've prescribed it to them and that you're following their progress. Me as a clinician, there's so much material on our website. It's all free and you have access to it as a registered clinician. And we also use it to provide structure to the treatment session. So the next slide. And as the last slide, the one message I have for you really is that I'd love you to go and get familiar with our website. I'd love you to register as a clinician, which is of course free. You'll see on there that we have an internet-based cognitive therapy foundations for clinician course. It's accredited by ACRM for CPD. And we have a newsletter that goes out roughly every month that is full of lots of interesting information that I'd encourage you to subscribe to. And then please contact us if we can support you in any way. So we love hearing from our clinicians. We love also learning what we can do better or differently. So I'd be very keen to hear from any of you if you had any further questions or comments. And I think I left a little bit of time for questions.
Fantastic. Thank you, Mike, for that great presentation. So we really have heard about a lot of the resources that are available to us and to our patients online, largely tonight with Phoenix and with This Way Up, and also, I guess, in person and phone-based with Chrono Plus as well. So does anyone have any questions that they would like to ask any of our presenters? I could start off with a question for you, Mike. I just wasn't clear. So with the clinicians, you were saying that basically they would go through the course as if you're a patient, like you participate in the course, or is it more like a training module that the clinicians would get?
Both. So my view is actually the best way to learn about what we do is firstly, one of the things that comes up is we actually don't know often how we're feeling in a sense. So we've got a thing on our website called Take a Test, and it's got validated questionnaires, and then it will suggest what course might be helpful for someone. So if we're not sure which course to do, then that's a really good way of the system being able to advise us. So I would encourage you to take a test, and that's like a temperature check, right? And then my favorite course, because it's the one that I use clinically the most, is the Mixed Anxiety and Depression course. And so certainly that's the one that I would encourage people to work through. Certainly if people are having difficulties with anxiety and depression, and to be frank, I mean, if we include all of the things that everybody has been through over the last couple of years, I mean, we're all participants in this. So I think that it is actually very helpful for all of us to be learning the basic skills of cognitive behavioural therapy and be looking at introducing them to our own lives, because then when we tell other people what to do or how to do them, there's much more of it. It's much more authentic. So that's the sort of clinical side of the website. But on the clinicians side of the website, there's a training module that's called ICBT Foundations for Clinicians, and then that takes you through the basics of using ICBT in your practice. So they're the two. Does that make more sense?
Yes, it does. Thank you. That really makes it clear. And I really like the idea of that take the test, because often as clinicians, we're just working and, you know, you keep going, and it's not necessarily until you fall over or, you know, in some way burn out or whatever that you realise you've got a problem. So that's actually a very useful self-care tool, almost disguised as training, really, which might suit some clinicians. Are there any more questions? I'm aware it's 8 o'clock. It's been a very interesting evening, and I think we will have some follow-up contact details. I'm sure the PHN team will send through some links to the resources, and we've got a code that hopefully everyone's written down for Mike's organisation. So if there are no more questions, I would really like to thank all the speakers for their time tonight and their presentations, and for sharing it with us, the work they do, and, you know, helping us as clinicians access training and resources. So thank you very much, and look forward to seeing, well, you know, having some of you join us again next time, some of the participants for the next Chrysalis webinar. Okay, so no last comments. Shane or Jenny, are you going to do the final Slido?
Hi, yes, I am. I've actually been launching the poll questions just towards the end there. So we'll just go through the results. After hearing the presentation, do you think you can implement some self-care strategies at work? And 100% of you have said yes, which is great, so that you've really gotten something out of the education tonight. The next one was, after hearing the presentation, do you think you can implement some self-care strategies at home? I might just leave that on there just for a few seconds in case some of you haven't had a chance to answer that one. But 100% of you are saying yes, so that's fantastic. And the last one was, after the presentation, are you more confident to detect and identify triggers for someone you work with who may be in distress? And again, 100% of you have said yes, so that's fantastic. I'm just going to open the evaluation now, and we would really appreciate if you could just take a minute to fill it in. It's just a fairly generic one, so it won't take very long. Thank you very much, everybody, for attending. This will be available on our website so that you can watch it again and share it with your colleagues. Okay, thank you. Good night.